Health Minister Greg Hunt is convening a roundtable in Melbourne today to discuss mental health and suicide prevention with some of the nation's leading experts. The despair is particularly acute in Indigenous communities, where at least 79 people have taken their own lives this year, amongst them 20 children. Fresh data released today points to perhaps some of the reasons why, with domestic violence, sexual abuse and poverty common factors. Gerry Georgatos leads the National Critical Response Trauma Recovery Project, which has compiled this latest report. He joins us from Perth this morning. Gerry, thanks very much for joining us again.
Good morning, Fran, and sorry to join on such a sad note.
Yeah, it is a sad note, isn't it? Your latest report looks into the causes leading to some of the shocking suicide statistics, which we've talked about, before here on the program with you. In terms of key factors, Gerry, what have you found?
Well, the reality is the data is as robust as it gets because it comes from the experiential responding to suicide-affected families, and now with the Trauma Recovery Project responding to those who attempt or suicidally ideate. And in unpacking their trauma, in unpacking their grief, nearly 100% of First Nations suicides are of people living below the poverty line. Nearly 100% of the 79 suicides this year, sadly, thus far, and pray it reverses the trend. It stops. 76 lived below the poverty line and the other 3 in proximity to it. That's 100% in effect. But domestic violence, sexual abuse, 1/3 of the youth suicides of 18 years and less, of which there were 20, and have been alongside child sexual abuse. Domestic violence in 2/3 of all suicides was prevalent, but the major causal factor is the poverty. There's a poverty that First Nations people still continue to experience. 40% of First Nations people across the continent still live below the poverty line, and some in a crushing poverty that is not fundamental to the poverty that other Australians, or the 14% of Australians who live below the poverty line, do not have in common.
I suppose if you did crunch the numbers perhaps you have, Gerry, for the other Australians who live below the poverty line, the suicide rates, I'm guessing, don't match up nevertheless.
The suicide rates aren't in parity. There's a disparity because of the crushing levels of poverty. But we've got to understand one thing. There's 40% of First Nations people living below the poverty line, another 20% in proximity to the poverty line. But there's 14% of Australians living below the poverty line. There's a 2.5 differential. The suicide rate of First Nations to the rest of the Australian population is also a 2.5 differential. So the correlation is that disparity in poverty. And for some of that poverty, it's almost inescapable because of the transgenerational nature of that poverty, the abominations of the past, the segregation, the apartheid practices, the inability to actually impart a legacy of positives that was not denied to other Australians. Migrant-born, as my family came to this country from socioeconomic disadvantage, but had the capacity to impart positive legacies to improve a lot of their children. That was denied generationally to First Nations families, and the mess that we're in today is in great part because of that structural damage.
And that's been recognised in the coronial inquest in WA and recently into the youth suicides and into the response from the state government there to some degree. This transgenerational nature of the poverty and the trauma, which is linked back to colonisation, is now recognised there in state government policy. I don't know if that's been dealt with yet or how policy has been impacted by that yet, but here we are on this very day. The Federal Health Minister Greg Hunt is convening this roundtable on mental health and suicide prevention. The minister's promising to obsessively seek to eliminate youth suicide. Does that kind of talk give you any hope? And does this information, this analysis of yours, where do you think that should point the government to in terms of first actions to be taken?
Well, the suicide crisis for all Australians, but much more pronounced for First Nations Australians, has been an unabated, uninterrupted crisis 3 decades long. However, there have been affirmative actions. In 1970, there were no First Nations doctors, there were no First Nations lawyers, there were no First Nations, or very few entrepreneurs. Today, there are nearly 500 First Nations doctors, so affirmative actions actually do work. People have been lifted up from poverty. There are 900 First Nations lawyers. There are many entrepreneurs, and half the population lives above the poverty line or in relative affluence. So,
half the Indigenous population.
Half the Indigenous population, as opposed to the majority of the Australian population. But we still have the circumstance of, in the remote, 8 out of 10 children will not complete a Year 12 education, and that's also because there's no access to secondary schools, no secondary schools in proximity to a lot of the communities or regional masses. But also, let's not forget the city masses, because the majority of suicides, First Nations, aren't actually in the remote. The highest rates are in the remote, particularly in the top end of Australia, the Kimberley, the Northern Territory in particular, and far north Queensland. But two-thirds of the three-quarters of the suicides First Nations are actually in our capital cities and in the large towns with populations more than 100,000. So there are critical services, but in the public housing rentals in our city masses, 1 in 2 First Nations children will not complete Year 12.
Gerry, can I just ask you finally, the federal government's committed $736 million to mental health, another $42 million for mental health initiatives, particularly targeting young and Indigenous people. This is in the last budget. From your analysis again, how would you like to see this money directed?
I'd love to see it hit the ground in terms of outreach. Outreach is a missing link. In terms of lifting people from poverty, that's a different context, because that's going to take a mass investment and a systemic approach, and we've got to lift more people up and affirmative actions. And I worked in the tertiary sector for a long while, and we brought in a lot of people through alternative pathways. And on a happy note for listeners, First Nation students who make it to university are amongst the most driven to succeed, and do succeed at the same rates as our migrant-born brothers and sisters who come from socioeconomic disadvantage to the highest graduate cohorts.
Okay.
So it's about giving capacity, but I'd like to see outreach on the ground. I'd like to see long-haul support through that outreach, and we've got to do these massive investments, but on a systemic approach, not on an ad hoc basis or a submission-based approach. Right. There's got to be a National Office of Suicide Prevention and dedicated suicide prevention minister to help frame the ways forward.
All right, Gerry, thank you very much for joining us. Congratulations on this research. Thank you.
Thank you, Fran. Much respect.
Gerry Georgatos leads the National Critical Response Trauma Recovery Project that's issued this research today. It coincides with the Minister for Health calling a roundtable dealing with mental health and suicide, discussing mental health and suicide prevention with some of the nation's leading experts. And really, these statistics, we've got to keep remembering them because we cannot forget them. So far this year, of the suicides in this country, 79 of them this year alone are amongst Indigenous Australians, and 20 of them Indigenous children.